Welcome to On The Beat, everyone. I'm over here with Dr. Starr from Golden Triangle Periodontal Centre. Today we're talking periodontal and how it affects your health, the do's and the don'ts. Welcome back to the show, my friend.
Thank you.
Look, we've talked about periodontal and diabetes.
Correct.
Okay? I want us to just explain to everyone at home how our health and our body affects our mouth and our teeth.
Well, it's very interesting. There's a lot of studies going on, a lot of research right now. We found a connection between periodontal pathogens and lots of other diseases. So you minimize the periodontal pathogens in your mouth, you minimize the amount of periodontal pathogens that are in your bloodstream, which could affect other organs.
Well, explain that to me right there. Periodontal what?
Disease.
No, pathogens, you said.
That's the bacteria that are bad. They're
okay,
bad bugs.
That's the bad stuff, everyone.
Yeah, they're bad bugs. We don't like those guys.
But how do we make sure we don't have them?
Well, you do it by good oral hygiene. You do it by good hygienic cleanings at your general dentist, and you maintain and you minimize the amount in there. They call it titers, amount of bacteria in the mouth.
Okay, I understand. All right, so let's talk about what some of those issues are for our health. Let's just break it down. As we said, we have talked about diabetes before, which I didn't realize either. So what are some other issues?
Well, there's a strong linkage to cardiovascular disease, and the theory is it's an inflammatory reaction to the bacteria going through your coronary arteries of your heart, and that could stimulate the plaque buildup, and you have an inflammatory response, and you start getting the clots and stuff.
Now, we just want everyone to know we are talking about our teeth, and it all stems from periodontal disease.
Yes.
So when we hear our heart, diabetes, people are thinking, Dr. Starr, what?
Yeah, I know it doesn't seem right, but the blood goes through your gums, goes through your body, which goes through the pump, which is your heart.
Yeah.
It also goes through the organs. There's also a strong increase in pancreatic cancers, kidney cancers. There's blood dyscrasias that are linkage. It's like a 54% increase in kidney cancers for patients that were found that had periodontal disease, untreated periodontal disease. So there's a huge increase they're seeing. So now there's all this research trying to figure out how we can treat it even better, and that's why we come to learn, let's kill the bugs.
What are some of the signs that they may have that?
Well, it's inflammatory disease, so bleeding, swelling, drains of pus and stuff around your teeth, loose teeth, bone loss. It's severe infections, you know. And if you suddenly snapped your fingers and they all started bleeding, you knock everybody down and run to the emergency room.
Of course, but why did we do that with our teeth? Why do we seem to forget about it? Maybe?
I don't know, but I do know that it is treated more early now with the general dentist population that has been educated to know how to handle that. So that helps a lot. It's a lot of intervention, but still nationally it's trending up, the amount of periodontal disease.
Is that because we have conversations like this where it doesn't seem so scary?
That's what I'm hopeful for. That's what I'm hopeful for. I want people to be healthy. And it's not just their teeth and gums, it's the total body.
Well, I just want to ask you about that. Someone sitting at home who's brand new to you, okay? What are you saying to them when they're coming in and they say, look, Dr. Starr, I know my teeth need to be probably pulled out and I can't cope. I just don't know how to get past that. What are you doing in your clinics to soothe them? Well,
we believe in DuPont's motto, better living through chemistry, if we have to really do some invasive things. But first off, it's education, education, education.
Okay.
They need to learn, and I need to teach them what the disease is, where they are, where they're headed, and how we can handle it. And once they do that and they understand it's not as invasive, it's not knives and string like the old days, and now it's lasers, lights, and medicine. It's more holistic approach to treating the disease. It's a heck of a lot easier than it used to be.
So again, we appreciate you. Thanks for coming in.
Thank you for having me here.
If you need any more information about periodontal disease and your health, everyone, give this doctor a call, Dr. Starr from Golden Triangle Periodontal Centre. He'll take care of all your dental needs. Back after this break.